Okay. All right. So we're going to turn our attention to, I think, a project that we're very, very proud of, and we feel very fortunate to have been able to carry out this project. And it's called our Coping Well project. And what we're going to do is we're going to have a series of three speakers, and I think three sessions. And what we're going to do is we're going to have each of the sessions kind of work through it. We'll start with community, we'll move to the Center of Wise Practices, we'll finish up with the UHN team, and then we'll have a conversation. Not really a question and answer period. We really just want it to be a conversation in true spirit that the work was done in. And so I'm going to start by introducing the Grand Council Treaty 3 folks first. Jim doesn't need another introduction. He is an ex-chief and an elder in the community and a well-respected member of the community. But I will tell you the story around Jim and the relationship to UHN. And so he mentioned it earlier today that he's been doing a few things. Diabetes is really important to him, and he was working on a wound care center and building a center of excellence for the community. And so I had been in on some of these discussions. The hyperbaric clinic kind of keeps fluttering up on the screen every now and again, but that was part of those discussions. But because of this relationship with Jim, when this opportunity came from SUAP, we were well positioned because we had a pre-existing relationship with the community. And it's one of the things we're really going to be talking to our funders about in terms of, these timelines can't really happen unless you have these pre-existing relationships. And because of that, that's how we were given the opportunity to even move forward and try to deliver on this project.
Good afternoon. As Hans said, my name is Jim Leonard. I was the chief of my community for 18 years. And during that time, we went through a lot of change, both good and bad. We started battling addictions and opiate abuse quite some time ago. We started around 2008. And at that time, with the opiate crisis, we were in really, really bad shape. One of the ladies in the community did a survey. And what she found is that out of the 300 people living in our community, roughly half were using some form of drug. And she presented it to us, and we were shocked. We knew we had a problem, but we didn't think it was that bad. And so what we did is we asked our staff to look at those numbers she provided. She provided that between the age of around 12 and 30, roughly 67 out of 88 young people were on one form of drug or another. So that's 3 out of 4 of our young people were using drugs. We further did some diving into it, and we found at the time that roughly half were using OxyContin. That's half of our young people were using OxyContin at the time. Well, that really, really shocked us. We had a series of community meetings, and we developed some strategies how to combat that abuse and that addiction. And over the period since around 2008 till today, we've been able to reduce drug addiction and opiates and that. From that roughly 150 people to somewhere around 10 or 12. So we reduced it by over 90%. When I retired as chief in 2017, Grand Council asked me to share our story with the rest of the nation. And so I started traveling to all the 28 communities, and I found that there was so much trouble and problems with addictions, and just widespread. And the number of overdoses that were happening was, astronomical. Just about that time, the coroner came out with his report, and what he indicated in that our area, there was 8 overdoses. My information was completely different than was his. I immediately saw the coroner's numbers, and I said, that's not right. That's definitely not right. So I went to the executive director, and I said, I want to do a research project and just find out what's really happening out there. And what my numbers revealed was 88. 88. So immediately we contacted the coroner to come to the area, in which he did fairly quickly. He was good about that. And we asked him to explain the discrepancy. And what we found is, or what he revealed to us, is that the way the coroners across the province record these deaths, like they could be recorded as a heart attack, they could be recorded as an infection, they could be recorded as natural causes, a multitude of things. But what we were trying to indicate to him is that we have a crisis here. I think the whole world has a crisis here. And if we're recording overdoses that way, then the 1 in 3 or the 1 in 10, I think when Dr. Noam said this morning, it's higher than that, tremendously higher than that. So we're still in discussions with the coroner, trying to get those numbers to match up and at least change the way coroners report and have contributing causes, instead of just saying natural causes, heart attack. A little personal story here is that I lost 2 children to addiction. Just recently, I lost my son last September. He overdosed. And to this day, I still have not received the coroner's report on an official cause of death. That's almost a year, and I still don't know. But I know in my heart, he died because he was using drugs. That's all I need to know. I don't have to know that he had X amount of milliliters of whatever in his system. He died of an overdose. So that makes my commitment that much stronger to bring, get true and accurate numbers of the number of overdoses that are happening, not only in our area, but across the province, across the country, because it's a lot worse than what's being recorded by governments. Just to conclude, talking about pain, and I think I mentioned this to Hans. 2 years ago, I was I had a scope done, and it was found that I have I had an abdominal aortic aneurysm, and I had the surgery done here in Toronto General. And because of my work in addictions, I told the hospital and the doctors that I did not want any narcotic or morphine or anything during my procedure. They agreed to it, but after some discussion, they agreed. So they did an epidermal in my back, and they told me that when you wake up, you're going to be in excruciating pain. So when I woke up, I was in tremendous pain. And right away, the nurse said, we can give you some Oxycontin. And I said I did not want Oxycontin or any kind of narcotic in my recovery. So they gave me Tylenol, but after 2 hours or so, the pain started coming back again. So I asked, can I have some more Tylenol? And they said, no, you can't, but you can have Oxycontin, because it was on my chart. And you don't know how frustrating and aggravating that is, because all I wanted was 2 Tylenols, but they were ready to give me Oxycontin because it was on my chart. So I think there's got to be more education to the doctors and the physicians and clinicians to explain to patients the true dangers of these narcotics. Another little story is my wife. She fell and fractured her shoulder, and she had to get surgery on it. Being a First Nation person, she had her surgery. Mind you, she went to Dryden, and she had day surgery on a major surgery here. But she was told when she got out of surgery in Dryden, you have to stay overnight, but you can't stay in the hospital, you have to stay in a hotel. So she stayed in the hotel, and the next day she went back to the hospital. And they discharged her, and they gave her a prescription. When she got home, she showed me a prescription, and it was 30 Oxycontin. But they never told her what it was. They just gave her the prescription without telling her what it was and the dangers of it. I said, throw that thing away. So she threw it away, and she managed with Advil and some pain, Tylenol and stuff. But I guess I keep, my message is that the health system has to spend more time in educating their clinicians and doctors to educate the patient. Spend 5 minutes, whether it's a doctor or a nurse, to explain what they're giving them. Because far too often in my travels throughout is that these medications are being given without any details at all. They just handed a piece of paper and take these pills and you'll get better. And unfortunately, many, many of them are becoming addicted and ending up on the street. During our consultations, my brother-in-law came to them because he's lived with pain all his life. He was in a car accident. He smashed up his ankle into 1,000 pieces, and they were going to amputate. And he said no. So they pieced him back together with screws and plates and things like that. And so he's been on narcotics for many, many, many years. And when he gets his prescription every month, he says within 2 weeks, he's out of pills. So he goes on the street to buy. And he said, one of these days, I'm going to get a bad pill and I'm going to overdose. When we were doing the consultations, if you can recall, Tony, we gave a small stipend to the people that come and presented to us. And we gave him his small stipend. He says, good. Now I can go buy some oxys. And he was serious. He was going downtown to buy some pills. But that's the state of what's happening out there today. And we have to do better. But with that, miigwech.